Hello and welcome to the Third Sector. I'm Tamara Brinkman, your host. In our society, there are three sectors: the public, the private, and the nonprofit. And it's that third sector that we're here to talk about today. Normally on the show, we highlight nonprofits and the work that they do for our community. Today, we're going to mix it up just a little bit. I've invited a representative from two organizations that provide funding opportunities for our nonprofits here locally. First up with me today is going to be Angela Cline. She is the Director of Community Benefits at Reid Health. And later in the show, joining me will be Monica Koechlein, who's president of Stam Koechlein Family Foundation. But as you see, we've got Angela first, and so we are welcoming Angela to the Third Sector. Thank you so much for joining us today.
Well, thank you for having me. I'm excited.
Well, I'm excited for you to be able to share with our nonprofit community about Reid Community Benefits. Why don't we start out with just a little bit of the history? So when did, from the beginning of time to where you are now, how did this all get started?
Well, so Community Benefit is the department at Reid Health that is challenged with making sure that we're being responsive to community health needs while also meeting our tax exemption purpose. Community benefit activities have been happening at hospitals for decades. But only in the last 10 years or so have there been some real regulations that monitored how those benefits were being delivered. So, years ago, hospitals may have gotten a request from a church for a wheelchair or something, and they made that donation. Maybe a Girl Scout troop needed a first aid kit, and so they made that donation. But really not with any strategy for impact, kind of just random acts of kindness. So it's a good thing that in the last few years, there have been, more regulation to that. With the passage in 2010 of the Affordable Care Act, the IRS laid down kind of some requirements. We're required to do a community health needs assessment every 3 years, which is a good thing, to make sure that we're actually addressing real needs, not just needs we're picking and choosing. So I think, that's a good thing for everyone. So with that, we kind of started doing more of a strategy for making an impact on those health needs. And one of the ways that we do that is by aligning our grant cycles with those particular health needs. And I think the grant cycles are probably the thing we're the most known for.
Yes. They just put a little graphic up to display some of the information about kind of your grant cycle and that you provided for us. So I know you can't see that where you are, but our viewers will see that. So you mentioned that you guys do the health assessment every few years, and that kind of helps you understand what's going on in the community and what the needs are. So tell me how that plays into the areas that you focus on funding, like what are important to, community benefits at Reid to support in our community?
Yes. So, as you would probably imagine, it changes depending on what the health needs are. So every 3 years, we do this needs assessment, which really is taking statistical data, things from the CDC, things, indicators from the Indiana State Department of Health, lots of statistical data. We have that data, which is obviously important. But another extremely important piece is that community input piece. So, we consider 8 counties to be our service area. So we get input from all 8 counties. We do a community survey that we put out. We also do multiple focus groups, just trying to glean information from folks about, what are you seeing in your community? Every county is a little bit different. I mean, even neighborhoods are different in the same county. So, it's important to get that perspective from folks about what they feel like those health needs are in their area. Because as you, I'm sure know, being a funding organization as well, data that we look at is old sometimes, so you may be looking to try to find data that will show what particular health needs are, but sometimes that data is 2 years old or more. And so, those lagging indicators can show us trend lines, but we really put a lot of value in what the folks in the community are seeing, and because that's typically much more accurate to what's happening at the moment.
Right.
So we take that community input as well as the statistical data, and kind of put that together to help determine what the top needs are in our 8-county service area. And then we invite community members to actually help us prioritize, okay, of these needs that have come up, which ones do you think are the top 3 we should be focusing on? And then with their input, those are the top 3 needs that we focus our funding on for the next 3 years.
Okay. So you mentioned 8 counties. Remind our viewers or share for those who aren't sure which 8 counties you're in, what those counties are.
Sure. So in Indiana, let's see if I can get them all. It's Wayne, Randolph, Henry, Union, Fayette, Franklin, and then in Ohio, Preble County and Darke County. And that's what we consider to be Reid's service area, because we do have a reach, kind of that far between our physician offices and things like that. That's typically where most of our patients come from. So
looking a little bit more specifically for the nonprofits, what is it that you all are looking for when you're considering an application from a nonprofit to fund that nonprofit?
Yes. So I think the most important thing is for nonprofits to know is that we lay out those grant cycles based off, we align them with those health needs. So one of the grant cycles for 2022 is for programs that meet the needs of mental health and substance misuse.
Okay.
And then within that application, there are points that we would like to see these applications impact. So we have a list of indicators for mental health and substance misuse. We're looking for these programs to make an impact on adults who smoke, the death rate due to drug poisoning, mothers who smoke during pregnancy, age-adjusted death rate to suicide, child abuse rate, ED visits for opioid overdose, poor mental health days.
Okay.
So we wouldn't require that a nonprofit hit every one of those, but we would hope that if you're applying in this grant cycle, your program or initiative that you're requesting funding for would hit one of those or more of those indicators, and it would be important for them to explain how they would impact.
Okay. Yeah, we put up a graphic that showed your 2022, and we saw the substance abuse and misuse as well as the mental health, and there were some dates on those that slide as far as, one grant cycle starts in the new year and what those date ranges are. So, and we are putting up website information. So for nonprofits or to our viewers that are looking, go to those websites and take a look, whether it's reidcommunities.org or just Reid Health and get to community benefits through that page. You can email to Angela and so forth and inquire and take a look at more specifically the information on those dates and so forth if you're looking to apply. Let's take just a little turn here, which is to say, what is the impact that you guys have, that your funding has on this community?
I couldn't give you the number of people necessarily just for the grants, but for all of our community benefit programming, we're impacting anywhere from 120 to 150,000 people.
Wow.
With community benefit. With the grants specifically, we were able to award last year 38 programs with funding of about $259,000. So it does make quite an impact for those nonprofits as well as the folks that they're serving with those programs.
Yeah. So what would happen if you guys ceased to exist in this community in terms of that funding support? I mean, clearly you gave us some numbers about just human population numbers that you're touching, but.
Sure. Specifically for our community as a whole, I do think when you're looking at like population health and public health, I do think that without community benefit reaching out into our counties, even further than Wayne County, I think that some of our communities are very rural and don't have access to a lot of different avenues for healthcare. So it's important that we be able to continue to reach out. I think it could be really it could be a struggle for some of those more rural groups if we weren't able to do some of the work that we're doing. Yeah. I also think for the nonprofits, a lot of them are able to get funding other places, like maybe from DMHA or more federal grants and things like that, or state grants. But a lot of times those exclude things, incentives or food or, things like that for their initiatives. So that's sometimes where we can jump in and provide some support to them where other grants maybe cannot.
Can you give us an overview of how your organization is governed?
Sure. So community benefit itself here in the hospital is just a department of 2 people. So we're a very small department covering a lot of territory. But we do have a board committee that like all of our grant applications and everything go to that board committee. So that board committee is made up of some governing board members from Reid Health's governing board, but also it's made up of some community members, some other employees of Reid that work in areas that are also like wellness and foundation, and some of those folks, marketing, some of those folks are also on our board committee. Those are the folks, the board committee are really the ones that give us in the department the direction on, approving our needs assessment and our implementation plan and our grant cycles. And when people apply for grants, we take those to our board committee and they make the decisions on who receives funding and who does not. So that's kind of our structure, our board committee, and then our department.
Okay. So with just a few seconds here, about 30 seconds left to go, it's not a lot. If an organization is looking to connect to you personally or to the community benefits, what's the best way for them to do that?
The reidhealth.org website and go to community benefit. They can also go to www.reidcommunities.org. That's a data site that we also run that they could help get data for their applications for as well, but they can also apply for their grants there as well.
Well, Angela, I can't thank you enough for coming on the show, with sharing the information that you did about the work that you do for our community. Thank you so much. We wish you a wonderful day, and we'll see you again soon. When we come back, joining me next will be Monica Koechlein from Stam Koechlein Family Foundation. Stay with us. And welcome back. Joining me now is Monica Koechlein, president of Stam Koechlein Family Foundation. Hello, Monica. How are you?
Hello, Tamara. Thanks for having me today.
Well, I'm so thrilled that you agreed to come on this episode. We're very excited to sort of shift it up a little bit and talk to a couple of funders. We had Angela on a bit earlier, Angela Cline from, as you know, Community Benefits at Reid Health, to share some information from their side and how they do things as a funder for our nonprofits and folks in the community. And I'm excited that we get to hear from you and the work that you guys are doing. Why don't we start out with just kind of a little bit of the history of how did you guys become a funder? How long have you been here? Kind of where you got from when you started to where you are now.
We were started in 2000 by a grant from Dave Stam and Terry Koechlein Bassel. They were graduates of Richmond in the early 70s, in 70 and 71. Found a life in California and were very happy and raised 2 daughters. And were very successful and felt that so much of their success was a direct result of the opportunities that they had received as children in Richmond. And so they felt very passionate about giving back and making sure other kids had the same opportunities that they did. So they put together some funding in the form of a grant and formed, at that time, the Stam Family Foundation. We made our first distribution in 2001 to the Boys and Girls Club and have been funding in Wayne County ever since. In 2003, Terry and Dave separated and eventually divorced. And then at that point in time, we became the Stam Coastline Family Foundation. So that's a little bit of our history. And it's just such a beautiful mission and story. I always think if I was successful and wanted to start a family foundation, I would start it in Richmond. I wouldn't start it in my hometown. And so I think it's such a beautiful story that they had lived in California for 25 years and yet still felt passionate about the opportunities that were provided here and wanted to be a part of supporting those.
That is, well, the community is very lucky for their philanthropic giving, their vision, and all the support that they're giving, that they and their family foundation, or your, as you represent, have provided to the community over these years. As we talk about areas of funding that are important to your organization, or areas that are important to you guys to support in the community, and that you do so through with your grant funding.
I think when we started, we really weren't sure what our mission was, other than geographical location, which was assigned to us by our founders, Dave and Terry. We watched our funding and what we were interested in through the years. And after about 3 years, we said, we certainly have a passion for the environment, and we certainly have our most important priority is children and opportunities. And so we've had fewer partners at different times. This year, I think we have the most partners we've ever had. This year, we have 29 partners. Wow. And we distributed just a little over $267,000 in support to those 29 partners. I think there's this fine line, right? There's all kinds of philosophical decisions that come into it and into the giving. And we're made up of a board of family members, and they're all geographically dispersed. In fact, my husband and I are the only 2 board members that live in Richmond. And so we have to constantly tell the story of what's happening in Richmond because they can't experience it like I can. We have to help the family get to know the leaders of those nonprofits. Even though, again, I said that they're not here and they don't see them out like I do at restaurants. So part of the work that I do is always trying to find partners that further our mission, that are can be trusted, are fiscally responsible, and if we could invest in them, they could do more. They could do more for the kids of this community. They could provide better programming. One thing we're really interested in also is strengthening nonprofits through capacity building efforts, through training sessions, training staff, training leaders, training boards. Because our belief is that if they become stronger, then they may not need our support, or they may need our support, but with our support, they could do more than just keep the lights on. Right. So we have an affinity for the Boys and Girls Clubs of Wayne County, our very first funded partner, and the partner that we have been with every year since 2001 when we made our first distribution. I would say in total, I think I added it up once, we've given over $500,000 in support to that organization. We're very proud of our work with that organization. But we've also have great affinities for programming that's happening after school besides the Boys and Girls Club. We're with Girls Inc. And we're passionate about Amigos and the work that they do with the Latino community. We're passionate about places like the Cardinal Greenway and Hayes Arboretum that are providing opportunities for outdoor access to youth and to families. And we're very passionate about the art through the Art Museum, the Civic Theater. I know I'm going to forget some of our partners, and they're also vital. They're also vital. So when we see an organization that we've been with for a while and they're experiencing some transition in leadership, and things may not be going as well as they had in the past, and we see them struggling, a lot of times we'll invest more rather than less, because we do believe transition is a hard time. Yes. And we want to be sure that we stay, that the investment that we've made stays strong.
Right.
And there are times when we will give a sizable gift because somebody's having you're running a capital campaign, which is really important. Or somebody, I know, we filtered, I guess, through a lot of the COVID situation. Some of our partners weren't able to program at all. And yet them being there, coming out of COVID, was so important to us that we were willing to continue to invest. And we were also willing to say, okay, now's the time where you get training. Now is the time when you refigure out who you need to be. Now is the time when you may need computer updates or whatever. So we continue to invest and stay with our partners. And I think I've been all around your question and probably back, but I'll stop there and let you ask the next one.
Well, no, I think it's wonderful to hear all of that, because it's, I obviously, in the role I do when I'm not doing this show, I'm also, represent an organization that provides funding for the community. And it's just great to hear what you guys are saying, as well as just the intentionality behind the funding to ensure sustainability for the organizations, and that they're functioning and thriving at their best place, because that's where, like you said, they're able to really do that great work for the community and provide those supports that are so needed, as we know. I would say, so if I'm a nonprofit, what is it that Stam Koechlein Family Foundation is looking for in a nonprofit when they apply for funding?
Yeah, I think we're looking for to further our mission. I mean, we could give $200 to every nonprofit in Wayne County and walk away and be done. But what we're looking to do is to build this community, build opportunities, strengthen this community from the inside out, and strengthen our nonprofits so they can carry out the missions that they have. I'm not interested in changing their mission or telling them what to do. I'm just interested in, they have a governing board to do that, to figure out who they need to be and what they need to be doing. I think we're looking for who do we trust, who can we count on, that if they had more, they would do more, and that not necessarily just more and more programming, right? But that the program would be impactful, right? And organizations would be thinking. So obviously, my other hat with the symphony, we're always thinking about. Every year we offer a program. What was the benefit, and what could we do better that would better fulfill the mission? Right. So we're also looking for organizations that have a strong governing board. We don't mind. We've had organizations like Richmond Art Museum with Lance Crow. That was one of our wins. He's the education director down there. He was a part-time position. They came to us probably 15 years ago and said, we'd like to make that a full-time position. We think we could do more for kids with that. And we supported that effort, took him to full-time, and the Art Museum has been able to maintain that. The Historical Museum needed an education director and couldn't afford one. And we knew that was important. And so we agreed to 3 years of supporting that position. Same at Hayes Arboretum. So we're really interested in if we could help you build and you could build capacity and serve kids better and then eventually sustain that position, we're willing to take that run and that risk with you, even if in the end it didn't quite work out as we expected. Right. So those are some things we're looking for. I think when we take a partner on for the first time, it's a little bit of a trial, right? So sometimes it's a smaller grant as $2,500 or $5,000. Yeah. When someone comes to us for the very first time and they have a really great idea and they ask for $50,000, I can't even give a piece of that, because if I gave $5,000, they couldn't fulfill the $50,000 project. Right. I think we're also looking for, if we get, and I ask that in the grant sometimes, so I think that drives people crazy, because they think if they say, I could do it with less, but we'll automatically give less. But if somebody asks
Right.
for 15,000 and I can only give them 10 and they needed 15 to carry out this project, I don't want to cripple them and hurt them.
Right.
And so a lot of times we ask, if we were only able to come in with a partial amount, would you still be able to carry out this project? And
Right.
everybody wants to say no because they want you to give the whole 15.
Right.
And sometimes we do,
Right.
but I don't want to cripple organizations and give them part of what they need to fulfill this new project or
Right.
carry out new work. We want to be really open. We want to be really, we want to know our partners. We've switched from, I think that was something COVID taught us. As soon as COVID hit, we said, no final reports are due. Okay.
Right.
I don't want to know how many kids you served. I know you didn't serve as many as you expected. That's fine. All I want to do is Zoom with you and make sure that you are healthy, you're safe, and you're okay.
Yeah.
And so we just stayed in contact that way. And then we watched as our nonprofits found creative ways to provide programming and celebrated that. So I think we want to be partners. And
Yeah.
I'm not saying that's different for a lot of funders.
I would
But
say
we really-
I would say you probably take a little bit more of an active role as a funder in some of your work alongside the organizations you support. We don't have much time left. I think we've got about a minute or so left.
Okay.
And so what I do want to ask you is one final question, which might be a little tough, is what impact does your funding have on our community? And what would happen if your funding ceased to exist?
Well, I'd love to believe that we've done enough work to strengthen this community that they could go out and fundraise the monies that we give them. I obviously we don't want to cripple this community and pull our support, but I think as we look at second generation that on our board that wasn't raised here,
Yeah.
we don't have the passion for Richmond that the original funders did. So we've got to continue to tell that story. I certainly believe and hope that that we've made an impact for kids.
Yeah.
I hope that. And I hope that we have strengthened nonprofits by being here. I don't know what would happen. Let's hope we never find out.
Right. We don't all have a crystal ball, but we don't want to look down that road.
No.
Well, listen, Monica, our time went quickly today. Want to thank you. As we wrap up this episode of The Third Sector, I want to thank both my guests today, Angela Cline from Community Benefits at Reid Health and Monica Koechlein from Stam Koechlein Family Foundation. Thanks so much for joining us and sharing how you support our nonprofits in the community. Stay with us, and we'll be back.